Hi guys, this is my poster up close. Sorry, I don't have any fancy equipment to help me out. So if you would just bear with me. Okay. Okay. Today my presentation is over nurse to patient ratio and patient outcome. This issue aims for improvement is inadequate nursing staff, which can negatively affect quality of care, patient safety, and nurse job satisfaction. Um, Many patients for one nurse causes great risk of nurse burnout and adverse patient outcome. Healthcare facilities continues to experience nursing shortage, resulting in increased workload and staffing issues. Research has connected inadequate staffing levels to a higher rate for patient complication and nurses turnover. There are three key holders in this issue, and they are the three key holders who would support this nurse driven topic: nurse managers, bedside registered nurses, and hospital administration. Bedside nurses are directly affected by the staffing ratio and patient workload. Nurse managers oversee staffing assignments and workload efficiencies. Administrator implement budget and staffing policies and organization quality improvement initiatives. Um, in my facility, we have such thing called nursing hours, nursing care hours. Um, when we have 30 patients, we could have like 6 to 7 nurses, which will have each have 4 to 5 patients. We'll have a nurse on call to 11 o'clock, and if a patient comes on the board, then we can call that nurse in. And if it does, a patient comes in on the board after, then someone would have an extra patient, and now might have 6 patients, which I feel is unsafe. Um, Iowa model of evidence-based practice lines up with this issue because it gives the framework that's systematic for identifying clinical issues, observing evidence, initiating practice changes, and evidence outcome related to nurse staffing, and patient safety. Many studies suggested that savings from reduced complications, shorter hospital stays, and improving retention can offset some staff costs. Evidence strongly supports maintaining safe number to patient ratios as a strategy to improve patient safety. Oh, sorry. Patient safety, reduce mortality, enhance patient satisfactions, and promote nurse well-being. Healthcare organizations that invest in adequate nursing staffing generally achieve better clinical outcome and higher quality of care. Proposed federal registered nurse to patient safety staff ratio on a med surg floor is 1 nurse to 4 patients, which I feel like um, is feasible. Um, like when we go into Epic and we pull up the charts, it's only space for 4, and like when you pull up 5, you would have to tap off and get into this chart, which sometimes nurses forget they have 5 patients sometimes. I don't know. But anywho, I just think it is unsafe. I think having the right amount of nurses to patients equals great quality